Hello, friends. Welcome to Akulmach Live. I'm your host, CK. And, in the series of discussing the impact of AI on our life, and specifically in the medical field, we are actually coming in front of you on our second edition where we have a very important guest joining in from Israel. His name is Benny Rubinstein. Let me read his credit. His profile needs a long introduction. He is a Wharton and Howard alumnus. He is the founding team member of the Future Health Summit. He is also the board member, CEO, and advisor uh, for various companies, especially specializing in the area of AI in the healthcare space. And also, he is a PhD candidate and he is currently doing research. In fact, before I invite him to our show, I would like to read out to his recent paper which he has submitted. And the name of the paper is Value Creation for Health Ecosystem Through Artificial Intelligence Applied to Physician Communication. And it's a very detailed study that has been published uh, just yesterday. So we will invite Benny to our discussion now, and we will talk about his work which he has done recently. Benny, welcome to Akulmach Live. Welcome, and how are you doing today?
Thank you so much. Thank God we're doing great. And thanks for having me back.
Benny, I had provided a long introduction to our viewers, and hearty congratulations for finishing your research. And finally, it was published yesterday. So, would you like to start the discussion by talking about, what kind of research you did and what challenges you face and what kind of pain points did you address in your paper? Over to you, Benny.
Yes, absolutely. Thank you so much for that. And it's such a great timing. As we spoke earlier, I am on sort of the mid of a journey, my PhD journey. My thesis is around the application of artificial intelligence in the context of physician discussions. So experts usually have their own, personal advisory board. There's a set of colleagues or professors or friends who have some expertise they might require, and we determined that AI could be a very good tool to augment those discussions and get some better outcomes out of it. We will talk more about that in a bit. So yesterday I got confirmation. Very excited about the publication of this first paper. It's a systematic review on the past 5 years. This field has evolving very fast, so we had to look back 2019 to 2024 on both the advancements on the AI side, on NLP, natural language processing, on deep learning, on generative AI, of course, and also obviously look at what are the particular areas that we need to address. There's a lot of opportunities and there are a lot of challenges, as we'll talk about later. And so we had to address things as how do you keep, ethical considerations, security considerations, privacy matters, and there's a long list of them. So it was a very thorough paper. It's probably about 24 pages long, I believe. And now that it's going to be published, I will actually start submitting my second publication, which will be a more sort of real life experiments with physicians as well as AI agents, which seems to be the big promise for 2025.
Well, we wish you all the best for your second paper, and we would like to always go to the journal where it is published and read it. In fact, recommend our viewers also to read this because this is an emerging field. Lot of development is happening world over. Even in India, there are so many companies which are currently developing the AI solutions in the healthcare, and excuse me, and this is exactly what we are talking about today. The use of AI, especially in the area of internal medicine, the physicians. So, Benny, we have one question which has been sent by our viewer, which I want to display it and ask you about the use of AI, especially in the area of internal medicine. So, the question number one is the what are some of the most significant advancement in the AI that are currently being integrated into patient care, how they are improving the outcome. So basically, how the AI agents is going to be implemented, and how they are going to help the physician to diagnose or probably provide the healthcare services to the patient.
Absolutely. And yeah, that's actually probably one of the most, I would say, advanced or maturing areas. The diagnosis. Um, I'll give you some particular examples so we don't keep too theoretical. So I would say the first one that's comes to mind is medical imaging. Clearly, there's a lot of research and there's a lot of considerations around, particularly the role of radiologists. Right, there's quite a lot of things that need to be analyzed. Computers are great at, computer vision have developed very well in the past few years. And now there is quite a lot of ways AI can help by analyzing images, be them X-rays or CT scans or any other kind of imaging modalities. So I can give you particular examples, companies that I've been talking to actually just this week here in Israel. There's a company called AI Doc. We're trying to see if they would be a fit for a very large healthcare provider in Latin America. Another one, a colleague of mine from Wharton founded, was recently acquired. It's called Zebra Medical Vision, and they basically use a lot of AI and deep learning techniques to process images and help doctors in sort of doing the kind of diagnosis. There are other areas that are maybe less known. I would say, as I said, these ones are being already used to assist radiologists in detecting conditions like osteoporosis, liver cancer, and many others with more accurately and more efficiently. But there's another very hot area. If you read about longevity and all the things that have been discussed these days, there's a whole area of personalized medicine that's been out for a while. And there are companies like K Health here in Israel that are actually using AI to basically provide some personalized health insights, do some symptom checking, and so on. So that's the second area. The third one I really wanted to bring up, it's a very controversial one, but it's one that probably is not given enough attention, which is mental health support, right? Particularly, I mean, it's all over the world, but particularly here in Israel, since the October 7 of 2023, we've seen a huge surge on people with all kinds of mental health needs, from traumas, from war, etc. And there's very concrete initiative here done by the Sheba Medical Center with Microsoft and KPMG that developed an AI avatar for post-trauma victims. Now, a lot of people are very skeptical about it. There's certainly a lot of things we'll discuss in terms of risks and how to do it properly. But this particular study has been published and achieved a 94% accuracy rate just in diagnosis compared to psychiatrist consultations, for example. So we're not trying to replace the physicians, but obviously we need to have tools that complement the need for people who need rehabilitation. So we could go on and on, but those are just a few examples, and maybe I'll name maybe one or two more that are more recent, which is robotics, right? So there's a lot of challenges also, not just with the diagnosis itself, but with getting enough doctors, nurses, professionals into healthcare. I think there is no secret. Most countries in Europe, US, I would assume India, Brazil, many other countries have a shortage of workforce. And so one of the things it's being done, for example, another company here in Israel is called Diagnostic Robotics, founded by a former colleague of mine in Microsoft Research. They actually have developed an AI-driven platform that allows to do some sort of prediction, and they can really streamline the process of resource allocation for personnel. So I could go on and on, but I hope that gives you like a little flavor of the top 4 or 5 advancements there. And like I said, they are actually happening. There are real companies doing real business and creating real outcomes.
So, Benny, I have some add-on questions based on what you told me just now. And you talked about the robotics, and you also mentioned about the shortage of healthcare workers. So, interestingly, what is happening is that India, being a very large country with huge population, India is actually providing a lot of healthcare professionals to the to the world, to US, to UK, to Africa, to Middle East. You go anywhere, you will see
Yeah.
the nursing staff from India. Couple of days back, when I did my research, I found that every year 30,000 nurses are being sent from India to UK. 30,000. It's not a small number; it's pretty large number. And now you're talking about robotics. So, a country like India, where the personal care and mental health definitely will will have a consumption or may have a requirement, but when it comes to fulfilling the needs of healthcare worker, which includes doctor, pharmacy, nurses, etc., how relevant that would be for India? I mean, just an add-on question to what you just told me.
Yeah. Well, as you say, I think every country or region will have their own challenges and economics, but in general terms, you could say that especially developing markets, right? If you look at Brazil, if you look at India, the BRIC, I would guess, the demographics call out for big problems, right? A big chunk of the population is aging. A big chunk of the healthcare professionals are just, they're not going to grow their personnel in the same scale. And so clearly there is got to be a better solution for that. Again, we're not advocating that robots will take over the world and there will be no physicians, but we also know that if we only leave the physicians to do their job as they do today, you see the numbers even in the US, like the amount of, I think over 40% of physicians are burnt out. Many of them are quitting their careers. And so we need to find a better way. So as I said, for today, we have robots that actually assist doctors. For example, there's a company here called Surgical Theater, and they basically assist surgeons in pediatric surgeries that are very complicated, very delicate, very risky. So it's not totally resolving the issue of we need to get more physicians, but it's actually getting better outcomes. Now, there are other situations, less critical around mental health, for example, like, it's been many years, we've been seeing two things. One, we've seen kind of robots that obviously they don't have emotions, but they can kind of generate a feeling in an elderly population that they're not alone. So there are robots that are companions. Of course, it would be better to have a family member or a nurse around. But if that can happen 24 by 7, these robots can kind of assist elderly population with many different things. As I said, the whole field about AI bots, which are now not just chatbots, they are becoming agents, is still in very fast development. There's a lot of buzz around it, a lot of skepticism for many. But the reality is, as I said, we did experiment in mental health. There are risks, of course, but that people who are doing some sort of mental health program, they obviously can't have a doctor with them all the time. So in combination with having some sessions with the human physician, they can actually use those tools, and it's been proven that if it's done properly, this can also help the outcome. So again, it's very interlinked. The ratio between patients and physicians is something that it's going to remain a challenge or grow. But as more AI tools get integrated, maybe hopefully physicians can dedicate more time to actually be with patients, to actually be present, to actually be humans, and allow a lot of the bureaucratic work, as well as a lot of the analysis of images or even tools for assisting in the diagnosis, help them to spend less time looking at a computer screen and more time actually dealing with the patient. Right? We're not just there for getting a prescription. We are there also to get the contact with another human being. Healthcare professionals help us cure just by also empathizing, connecting with us, not only by prescribing drugs or things like that.
Well, Benny, in fact, you have given us good points here. Just one thing I like to add here is that the average age of India is 26 years. It's a very young nation, one of the youngest in the world, and therefore robotics maybe, I mean, from my point of view, it will take longer time to penetrate in India. However, you mentioned about the mental health, which is becoming a very big issue here in India, especially among the youngsters. And uh, you know, if I'm not mistaken, in 2018, the gaming was classified as a mental health issue if it is abused. And today, what is happening is that these youngsters are too much involved in gaming, and um, which is sort of a side effect of AI, because if you're using AI agent, you have to use some sort of system. So how do you see benefits of AI in getting rid of the gaming addiction specifically?
Yeah, that's a very interesting topic you bring up. I must say, I don't have a 100% perfect answer for you, but I can tell you that one of the things that we are researching, and I'm following other researchers in the area, as we talk about AI, specifically what they call agentic AIs or AI agents, they're becoming very popular today. Yes, there's always two sides to the coin. On one hand, AI can be used for getting people, as you say, more hooked into products, right? And it's not just in bots. I mean, we see that when you open your Netflix or your Amazon Prime or your Xbox. I've worked for Microsoft on the e-commerce side. I mean, obviously use AI to provide better recommendations to people, to better personalization, which is a good thing, but it also gets them kind of hooked and make them consume more. So that can also have some side effects, as you said. And so one of the interesting things about AI agents is that, again, we're in the kind of early stages of the curve, but part of the research is something called swarm agents intelligence, which is basically thinking about not just one agent trying to get you to do a certain task, but having a population of agents that can kind of balance out each other. So imagine, for example, it is part of the research, you can get an agent that actually is driving certain behavior on a person, and there's another agent that's kind of trying to counter balance that and generate the opposite side, or making sure that you don't get to extremes. So there's many ways that this can be done. So what I'm trying to say is, think about it not just one physician or one robot or one chatbot, but think about it as a collection of them with different goals, different personalities, or different characters, or different missions, or different skills. And when you put them all together, you can create, like we do in society, hopefully a more organized ecosystem that actually can, be more sensitive to those things, and have a more diverse set of responses to your stimulations.
Great, Benny. I think it's time to move to the next question that our viewer has sent before the start of our live stream. The next question is, from your experience, what are the potential ethical concerns and challenges that arise with the use of AI, especially in the internal medicine department?
Definitely. Yeah, so again, I'm very passionate about AI in healthcare, and I gave you a few examples of great companies doing great things. There is no short list of challenges, and that's why we're all here working together to address many of them. Um, I will come up with just the ones I think are more relevant and worth going through. The first of them is called transparency, or there's a term that was coined explainable AI. Sometimes there's an acronym XAI. And basically what it means is, if you think about it, AI is supposed to enable doctors to make better decisions, right? And in order to make a well-informed decision, a doctor can't just fully trust 100% of a system that's basically a black box, right? I put in this data, this is what it's telling me to do. Well, the doctor is a human, and he's going to want to do some reasoning. He's going to think, why is it recommending this and not that? And did it take these things into consideration? So you can see that it's a very problematic situation if a physician is just going to have an input and an output. So making sure these algorithms, these AI algorithms, are explainable means I understand how they got to this conclusion. For example, I worked with many clients here in Israel where we use the tool that uses generative AI, but it's actually based on evolutionary algorithms, genetic algorithms. So we could actually optimize their AI systems, but we actually told them this is how we got to this algorithm, and they can basically agree or disagree, but they know how we got there. So that's one of the main issues. I must say that this is an area that still needs a lot of work, and it's imperative for bigger adoption. Another one, it's a term that's also used maybe loosely sometimes. It's algorithmic bias, right? We all biased. I'm biased. You're biased. I mean, we all have kind of our own set of experiences and learning. We don't know what we don't know, but algorithms in AI can actually exacerbate that bias, because if you train that model in a set of data, for example, that has only white people, or that has only men, or has only whatever that is, right? Ethnicity, gender, age, whatever the variable is, if you train that based on a population that's, for example, maybe people in India may have some issues that are not so popular in other geographies. So if you train a system based on a very limited set, and it's very hard to get a perfect training data set, you may end up with reinforcing some sort of patterns that may end up working out very well for a certain population, but may actually have poor results for other sides of the population. So there's ways to address that. I'm researching, for example, synthetic data and other things we can do to augment that data. I think those are two big ones. The third one, very common, is data privacy and security. Again, that's not an issue only in healthcare. There's this morning I woke up and I had a charge from Walmart.com on my on my Bank of America debit card. I don't use my debit card and I don't buy on Walmart, and so I had to report it fraud. Now imagine if my my patient health records had gone public. Imagine if my last exam at the hospital at Shiba Medical got sold to someone else. So bad things could happen, and so there is a lot of, with AI we create a lot of opportunities, but we also can use AI for bad things. So one of the things I had to address on my paper was, how do you make sure that when you do all these great things with AI in health, you're not opening holes that bad actors can explore through cyber threats. So those are some of the things. And very briefly, a last one, obviously, is more human, is the over reliance on technology. This happens, by the way, in healthcare, in defense, in many other industries. When people get really good technology, you may see that technology is 98 or 99% good, and you may relax. You may say, okay, this is working. I don't really need to do much. And that's a danger, right? Because in very critical industries like those two, as I mentioned, for example, defense or health, you can't afford to just rely solely on technology. So those are a couple of things that are risks, and there are certain ways that we should work to not compromise our critical thinking skills.
Well, you mentioned about the AI developing a bias, which has been in news quite lately, quite often, and certain heads have been rolled in large companies like Microsoft and Google because of this issue. Uh, Interestingly enough, there is a lot of emphasis in India about AI. Everybody is talking about AI. We have to implement AI in this function, taxation. Everywhere. Even the Prime Minister of India is making statements about AI. So there has been a lot of conversation going on, but nobody's talking about the biases. I think one of the key element of using any system, because you mentioned about that, is building checks and balances. There different fraud detection checks and balances. I think if the government does not implement those checks and balances, then personally I believe that the adaptation of AI may not happen in a very big way, or it may take a lot of time. What is your opinion on that? Very quickly, if you can answer that.
Yeah, it's a very complex topic, to be honest, but I'll share my personal views, and there's a long debate on that. There's no perfect answer. First of all, I really try always to start on the same point, which sometimes is left out of this discussion. We as human beings, we created AI systems, and we are severely biased. So we cannot leave that out of the equation. We can't just always blame technology for something that societies haven't addressed. So societies are biased, and there's a lot of issues around that. And so I wanted to start from that. Like, we need to resolve this at a human level, first of all. That said, when you build AI systems, as I said, there's many angles to that. And there's a lot of goodness. For example, I was mentioning before a company here called Zebra Medical Vision. If you go to the World Economic Forum, they actually listed among their mission statement that they wanted to provide access to healthcare to pretty much everyone at a very low cost. So one of the things that you could say it's biased is just economic bias, right? So if I have a great technology but requires certain standards that probably I can't afford, that's already a bias, right? The other kind of bias, as I said, could be that I'm building a system that only applies well to a certain ethnicity or whatever. So we talked about it. The way you address that, there's many levels. The first one, as you said, it's good governance, right? Same with any initiative like diversity and inclusion, whatever. Those are great causes, but if you don't actually manage them well, it could actually go sideways. It could actually even be counter-effective. So you need to have a governance system, and there is no perfect one. Here in Israel, there is a kind of a decentralized regulatory guideline that it's borrowed from the European Union, but it also, unlike the European Union that has a comprehensive AI Act, we actually have a more or less formal, more like a policy-driven approach where you basically use different regulatory frameworks and some globally accepted principles. So having this set of principles creates what we call responsible AI. And that's not just a statement you put on your boarding room and you say, well, we are responsible executives. You actually have to implement that. And again, that's another area that is in development. So there's many ways. I'm giving you a very long answer, but there is no like silver bullet. Again, what I wanted to say is we as humans need to first agree on what that is. I spent 6 hours in a round table that was held in Europe, and a lot of stakeholders, a lot of great debates, but no real conclusion. So we need to be careful about that. We need to agree on the principles, first of all, which are not, it's not an easy task. And then we need to make sure that we can implement that and have some sort of, no system will be perfect, so some sort of checks and balances, as you said, and some ways to kind of do a constant monitoring. And just basically, as we do in cyber or many other areas, you just need to kind of every now and then check and see, is this going the right route or not? If not, you need to do an intervention.
Absolutely, Benny. I think the government people are not having census on the election process itself. I mean, we will wait and watch. We will go to the third question for now, and that is, how do you see the role of healthcare professional evolving with increase in reliance on AI technology?
Yeah, so that's a very interesting topic, and it's coming out of my paper as a not so surprising but very eminent trend, which is as you look at the way medicine evolved. You have typically GPs or family doctors that are pretty let's say generic, right? So I go to see my GP here in Israel, and she would see me for, I don't know, 5 minutes. I'll describe her what I have. She's going to either prescribe something for me, or she's going to refer me to a specialist to do a particular exam or something like that, right? Then you have the super ultra eyelid specialist, which is not even just a generic ophthalmologist. It specializes in eyelids, and this is not fictitious. I had a problem there in the US, and I had to do that. So what do we see now, especially when you use AI? This creates problems, right? Because it creates silos. When you use AI, one of the biggest benefits is that AI sort of begs for multidisciplinary approach. So, for example, a lot of the research that I covered in my systematic review covered like how do you use AI, for example, for training teams, right? As you think of a healthcare provider, a hospital, there is a team of there's a surgeon, there is an anesthesiologist, there is a nurse, there is so many people involved, and the communication is usually an issue. So you can use AI for improving that, for example. So the reality is that healthcare professionals will have to not just be passively adopting AI technologies, because we've seen that usually doesn't go so well. In my personal opinion, and also in what I'm uncovering the research, the way to make AI really effective and safe and used by physicians and other medical professionals is by actually having them be part of the loop. From the beginning on the design, how the workflow will work, because that's important for them, up to how do they actually trust the outcome of that tool.
I think what you're saying makes a lot of sense. Like you mentioned about the personal healthcare for patient, I think there has to be a personal usage of AI by each physician and general practitioners, as you mentioned. Let's quickly move to the fourth question that we have, and that is, can you share any real life examples? I know you have, but I think there is something more here which you can add, where AI has both succeeded and failed in delivering patient care, and what lessons can be learned from these instances?
Yeah, so there's many success stories. I think I mentioned a few of them that I personally witnessed. I didn't read on the papers. I mentioned Surgical Theater as a company that I personally went to this crowd event a couple of years here in Israel, and I literally cried with other thousands of people. This is something that saved the lives of many kids that would probably never walk again, and they're now playing soccer. The physicians were concerned about the delicate surgery they had to do, and that kind of technology really assisted them with VR, like AR, like augmented reality, and lots of other things. Those are some of the successes. There's a very long list. I would repeat, mental health is something that we totally undermine. I think this pilot done here in Israel with Sheba Medical Center, Microsoft and KPMG showed amazing results. And of course, there are still things to be addressed, but really helping people recover, whether it's PTSD, whether it's any kind of mental disorder or challenge people are going through. There is not a short number of people who are going through that right now. Those are like great success stories. And again, we can go on and on. Um, you know, Unfortunately, it's funny. Like I have to say that if you go on any AI tool like Perplexity, which is a very good tool, and it's kind of a mix between Google search and ChatGPT. It does a great job finding references. You don't find many um, uh, not successful stories, and that's not, again, the fault of AI. It's the fault of us humans. We don't like to publish horror stories. We do that internally sometimes, post-mortems, but it's something that, again, part of my discussions with some physicians in Brazil was whether we could use AI to even do post-mortems, like patients die, right? People die. My father passed 4 months ago in the ICU, and I think the doctors did the best they could, but the head of the ICU told me, we would love to use some AI tools to see if we could have done even better, right? And to learn from next time. And so this is like an area that's very sensitive. There's a lot of failures of humans, but also failures of systems. They're not very well published, and I think that there's a whole movement now even to publish more of those, even in the academia, but the incentives are not there yet. So it's hard for us to know. But like I said, I can tell you just a short personal story. I was a global product manager in Microsoft Research for Health Solutions Group, and I was responsible for launching Microsoft Health Vault. It was an amazing tool. It was born before the cloud, before Azure, so it was very early stages. But we did amazing work with the NHS, with the Ministry of Health in Canada. Got some awards. It was a really great project. But 10 years later, this product was killed, and there's some reasons for that. But I'd say that there's an article somebody wrote about it saying that it was a big failure. Personally, I think that we learn a lot from those failures. I think that sometimes we're too early to the market. In that particular case, I think the main issue was how do you create the right incentives in the whole healthcare ecosystem so that both consumers, like patients or citizens, and providers are all aligned, share data. So there's a lot of issues that are not just technological, it's also around incentives. And I guess I could write a chapter of a book about that for next time.
So, on the lighter note, Benny, I think the failures will be very glaring when the AI is implemented by the dentist. So, we'll just leave it at that. Uh, Move to the next question, which is the last question of our session today. And that is, what measures are being taken to ensure patient data privacy and security when using AI in healthcare? And how can patients be assured that their information is safe?
Yeah, again, very great topic, and I guess I mentioned before, but I want to be full disclosure. That's an area that I I was asked to do some minor revisions on my paper, which delayed it by a few months, but I think it was a great improvement. As I said, there is as we get more developed in AI, we get more developed in great AI healthcare applications as well. But also the hackers get more creative on how to be a hacker using AI, right? So everything has their good and not so great side. So we need to bear that in mind. So a lot of um, the measures being taken here are sort of around more advanced encryption, right? So there's different AI-driven security systems that use advanced encryption methods to protect sensitive patient data, for example. Um, there is a lot of work actually around patient education. We didn't talk much about it here, but like we need to work on financial literacy, we need to work on health literacy, we need to work on AI literacy. Here, like how the patient manages their money, for example, can avoid frauds. And in health, how the patient actually are informed by healthcare providers in terms of the risks involved in, for example, doing telehealth services or other things, is something that also can avoid a lot of bad mistakes. So again, there is work around that. Real-time monitoring, other things I think we discussed. And as I said, the whole regulatory matters. It's not going to solve all the problems, but I think here in Israel we try to use a very agile approach, right? We don't want to there is no particular Israeli law for AI. We adopt different standards from different places. We create that based on use cases, based on the industries. So it's a little bit more agile and more policy driven. Um, and then last but not least, of course, one of the things that we actually even overdid when I was a product manager for Health Vault is work on consents and transparency, right? Every time that you have to read, 25 pages of font 4.5 and say, I agree to do something, you're probably creating, maybe you're protecting yourself, but you're not being very transparent because nobody will read it. So making sure that people are sort of informed in a very user-friendly way, not in the legal jargon, that the patient understands that the data might be used for some research. Here in Israel, we actually use, unlike the US, a lot of patient data from the birth until the death for research, right? And of course, it's anonymized. There's quite a lot of care on that, but we actually use a lot of the data. So as long as you do consent, transparency, and you can actually know what your data is going to be used for or not, and authorized or not, the better we'll be prepared for that. So I hope that helps. It's not the most comprehensive list, but those are some things that typically, if you do them properly, you mitigate a lot the risks and disappointments.
Absolutely, Benny. In fact, the cybersecurity is becoming a very, very important subject in addition to AI. In fact, because of the geopolitical issues, what we have been noticing is that the bad guys are now attacking hospitals. Uh, we have seen that happening in India. We have also seen that happening in Israel. And my father used to say, what they are going to get by attacking a hospital. But I think there must be something going on there, and therefore, very huge, humongous systems are being implemented in hospitals in India to prevent any hacking possibilities here. So I think, I mean, we are actually having an online interview. These are very big subjects, require more lengthy discussions. So, Benny, it was really wonderful, talking to you, and you know, we thank you a lot for sharing your ideas. And we have recently published a research paper which is really remarkable. And thank you once again. And to all my viewers, if they have any questions about any job insecurity, especially if you are in the healthcare space, you can reach out to us, or you can reach out to Benny directly. His coordinates are given in the description below. So, Benny, thank you so much, and I let you go today, but only to catch you again next time.
Thank you so much, and let's stay healthy in 2025.
Thank you, and bye bye, Benny. So, friends, we had a fantastic discussion with Benny today, and he discussed so many things with us. And he has also mentioned all of these things in his research document, which is going to be read by a lot of healthcare professionals world over. So, if you want, you can reach out to me. I can provide a copy of that publication. Or if you have any questions regarding how it is going to happen, I'm sure there are a lot of questions people have today. Is AI going to come and take my job? is a physician going to be replaced by AI? So there are so many questions you must be having. Just in case if you have any doubt, you can reach out to us. We will make the connection happen directly between you and Benny, or you can reach out to him directly, write to him. His coordinates are given in the description below. So thank you for watching us live. We will catch you again in the next one. Bye for now.